It was September 12th, 2017. I remember it like it was yesterday. It was a beautiful day in Dallas, Texas. And I worked from home at that time, which now a lot of us can relate to. Back then it was before COVID. And so I had to get out and go to a local coffee shop, my favorite coffee shop, and just get out of the house. So I ventured down there, and I was sitting there working, and I got a phone call from my husband, which was kind of strange because we typically don't call each other during the day. And he said, "What are you doing?" I said, "Oh, I'm at our favorite coffee shop, just had to get out of the house today." He said, "Okay, I'm gonna come and stop by." Now this was really weird. And I thought, okay. So we hung up, and as I started to walk outside, I got really excited because my birthday was 10 days away. And I don't know about you, but I love surprises. And my husband knows I love surprises. So I was excitedly walking to the car as he pulled up, and I jumped in. And as I turned to face him, I knew I was not getting a fun birthday surprise. He turned to me and said, "Your sister Megan has cancer." And I immediately burst into tears. My sister was my best friend from the day I was born. And so I sat there and I sobbed, and he started to tell me what had been going on for probably the last hour or so, unbeknownst to me. And then he told me that she had non-hodgkin's lymphoma, and I cried harder because, as Samantha mentioned, my father, Mike, had passed away from non-hodgkin's lymphoma 20 years prior. So all the fear, the worry, the trauma was just coming to the surface. As time went on, this is my sister Megan, by the way. As time went on, Megan went through chemotherapy treatments, and there's my father, Mike, and me as a little girl. I was much cuter then. So as time went on, Megan went through chemotherapy treatments, and we found out, the doctors informed us, that Megan probably had cancer for about a year, and she just didn't know it. The cancer caused an autoimmune disease, and the autoimmune disease caused a very rare and aggressive lung disease. And I like to say that this is one time in life you do not want to be rare, is in healthcare. Because if you are rare, that means that not many people have the disease that you have. It means that not a lot of research has probably been done. And it means that most likely there's no cure. So Megan went through chemotherapy treatment. She lost her hair. She lost a ton of weight. And she didn't have a lot of weight to lose. And before Megan was sick, she was a former college athlete. And still as an adult, she was involved in athletics. She took care of herself. So she went from this strong, athletic mom of 2 young girls to a frail, thin patient who could barely walk to the kitchen without help. It was hard to watch her struggle like this. And at this time, Megan and my mom and my brother and my sister's family, they all lived in Charleston, South Carolina. So I would fly back and forth to support Megan when I could. I also had a young child of my own at the time. As background, I have been in the pharmaceutical industry for over 20 years at this point. And I realized that when I was with Megan, whether in the hospital, speaking to her physicians, or if I went to a doctor's appointment with her, or even with her at home, that my knowledge and my experience as a pharmaceutical rep, and then now in my career I'm in learning and development, it was really coming in handy. Because I've learned, and I'm comfortable with speaking to physicians, that's been my whole career. I teach other sales reps how to speak to physicians and nurses. I teach them how to ask good questions. I teach them how to communicate with different personalities that might not be like their own. And all of these things really came in handy. Unfortunately, my sister would also pass away 3 days before her 48th birthday. So after she passed away, I obviously was heartbroken, so was my family. And I had to do something with this grief. And so to pull myself out of this dark place, I wrote a book, as Samantha said, and I know you're probably going to giggle at this title, Badass Advocate, Becoming the Champion Your Seriously Ill Loved One Deserves. And the goal of this book is to share strategies that my family figured out along the way, things that we did well, things that we didn't do well, and then also the things that I've learned in my career that have really helped me to be a better advocate for my sister, and since then for my best friend who's a 3-time cancer survivor, for my mother-in-law who's had some recent health struggles. These things really work. They're simple, but they're effective. And so I'm going to share some of those with you today. And I want you to have this mindset, and that's what we're going to talk about for the rest of this session, is having the mindset that you are a team with the physicians, with the nurses, with the patient. Everyone is here with the same purpose. That purpose is to get your loved one the best care possible, and ultimately, hopefully, to get them healthy. That healthy part is not always within our control. It wasn't in my case. I hope it is in yours. But we can support them and fight for them to get the best care possible. And that's what we're going to talk about today. So there's 5 key things we're going to go over today. Number 1 is the importance of building a support team. How do you do that? What does that look like? Number 2 is the importance of brainstorming as a team, and I'm going to give you some tips there. This is probably my most popular topic that people want to hear about, is asking effective questions. So this is where my sales techniques come in, and I'm going to teach you a very simple technique to create more powerful questions. We all know that physicians have limited time. They have lots of patients that they have to see. They have lots of paperwork they have to fill out. That's just the nature of their job. They're not to be blamed for that. But how can we make the best use of our time with them? Let's use that time to our advantage. And then last but not least, I want to talk about palliative care. I think there's a lot of misunderstanding about palliative care, and my sister had a palliative care physician. I love this woman. I'm still in contact with her today, and I just like to talk about the benefits of palliative care and what they can do for you, especially since we have a room full of people that are connected to cancer.